Assalamualaikum and hi to madam. Today I'm Dira and Dina gonna present about parasite Filariasis helminth. So now I'm going to do it for introduction about filariasis. So basically, filariasis is a parasite disease transmitted by black flies and mosquito. These parasites are thin, around worm-like organisms. They appear with white or translucent when observed under a microscope. So the lifespan of filariasis will be around 5 to 7 years. During their lifespan, they produce a million of larvae. The size of the female is between 215 until 200 micromilliliter long, and the size of the male is roughly half as long as the female. Next is about the etiology. So basically, Paris is the roundworm of the Florida types. Its primary vector is a mosquito and black flies. So the infection spread when a mosquito bites an already infected include and then goes on to bite a healthy person. This causes the larva of the parasite to enter the bloodstream of a healthy host and multiple. Complete stage of the larva to adult flare worm is carrying out within the lymphatic system. Once get matured, the adult flare worm start to release a microflaria. The newly generated microflaria again enter into the mosquito along with the host blood, and the cycle repeats itself. So next is about the species of Filariasis. So basically, Filariasis have three species. That's the major causes of lymphatics filariasis. First one is Wuchereria bancrofti. Is a parasite worm, nematodes. Is a morphology. There are distinct male and female worms. We call it as a dioecious. Is how its transmission is separated by various mosquito species, include those from the Anopheles, Culex, Aedes, and Mansonia genesis. So for the last cycle, is go to larva that introduced to a human host bloodstream through the bites of a infected mosquito. So it get developed into adults within the lymphatic system, causing inflammation and blocking the lymphatic vessel. Adult worms produce microflaria, which is the immature larva that circulates in the blood and are taken up by mosquito during the blood meals, and it's gonna continue the cycle until end. Chiri, chiri. So next about the Filariasis species, we have a Brugia malayi. Basically, is a parasite worm belong to the phylum nematodes. For the morphology, it is smaller than a Wuchereria bancrofti and appear as a delicate thread-like organism. For how its transmissions is primarily transmitted by Mansonia and Anopheles mosquito. And for life cycle, is after being transmitted by the mosquito bite, larvae migrate to the lymphatic system where they maturate into adults, causing chronic infections. For the last one about the species is called Burgia timori. So it is a parasite worm responsible for causing lymphatic filariasis, much like its counterparts, Wuchereria bancrofti and Burgia malayi. So morphology, filarial nematodes with adult worm residing in the human lymphatic system. So how is transmission? Is primary vector for Burgia timori system in the Anopheles barbinostres mosquito. So for life cycle, is go to larva enter the human host through mosquito bites and develop into adult worms within the lymphatic system. And then the adult worms produce the microflaria, the immature filariasis, which are then taken up by mosquito during the subsequent bites, and the life cycle is going to continue until the end. So for the next, I will explain about sign and symptom if we get the filariasis infections. So during its early stage includes we can getting fever, chill, headache, and skin lesions are observed in the beginning stage, and others between 3 months to 9 months after the insect's bite. In the later stage include blockage in the lymphatic system which leads to edema, swelling, redness, and pain in the arm and leg. And the last one, for sign and symptom, again accumulation of pus in cell. And now I will go to the treatment part. So basically, you have an infection from filariasis, we can get for medical and surgical. So we have two treatment methods. So for medical, we get a major anti-parasite drugs. We have three drugs for parasites, for anti-parasites. We have ivermectin, albendazole, dicarbamazine, or we can call it is DEC, to get rid of the larva worms to inhibit its reproduction of the adult worms or to kill the adult worms. So that's a function for the all the anti-parasite drugs. And the next one, if we go to the medical is not functioning, we go to the surgical. It's for abnormal accumulation of fluid in the scrotum, the hydrocele, and remove the remnant of adult worms. So for the last part, I will go to filariasis in Malaysia. So I'll conclude it about that. For lymphatic filariasis, and we call it as a LF, remain a public health concern in Malaysia, with a case reported in Sabah, Sarawak, and part of Peninsular Malaysia, include Terengganu, Kelantan, Pahang, Selangor, and Johor. The disease causes by Wuchereria bancrofti and Burgia malayi and transmitted by Anopheles and Mansoria mosquito. Due to several conditions such as pedema, elephantiasis, affected social and economic productivity. To combat LF, Malaysia conducted five rounds of mass drug administrations (MDA) between 2004 until 2008. For arches over 18% covered by transmitted assessment survey, in 2010 until 2011, indicated presented case resisting continue MDA efforts. A study in Kemaman, Terengganu revealed that while 83.9 of respondents were aware of lymphatic filariasis, only 35.2% know about the MDA program and just 20% had participated. Also, 77.2% recognized mosquito as the transmissive vector. A knowledge about the treatment and preventive measure remained poor, with a significant portions of the population not engaging in mosquito control. So, awareness of lymphatic filariasis show to the significant concern with gender, age, education, or income, highlighting the need for targeted public education for campaign to improve understanding and participate in lymphatic filariasis. Elimination efforts, strengthening MDA cartridge ensure drug compliance and change mosquito control measures are poorly formulated to achieve lymphatic filariasis eliminations. So that's it for me, and now I'll pass to Dina.
Okay, thank you, Dira, and I will continue about the case report of lymphatic filariasis over the upper arm. As you guys know, basically, if you hear about filariasis, it's basically it will affect at the lower limb. So here is the cases for the upper arms. So here is the patient information, which is a female, 22 years old, that have a sign and symptom, which is the patient was presented with a non-tender swelling over the left upper arm, and also no other symptom or systemic manifestation that were reported. Okay, so here is the patient history. She was presented to the orthopedic outpatient department with complaint of painless swelling over the lateral aspect of her left upper arm for 5 months continuous. So there was no antecedent history of injury or trauma that was caused by from it, and there was also no history of similar swelling elsewhere in the body or of a constitutional symptom that was associated with the swelling upper arm. Okay, so here is the diagnostic approach, which is basically it was diagnosed based on the clinical examination, which is the circulating filarial antigen CFA test that is the definitive method for the Wucheria Bancrofti detection. And also was also other supportive tests also was used, include blood smear for microfilaria, typically doing at night, and also the ultrasound for detecting live worm in the lymphatic system. So here is the result of the clinical examination. The fine needle aspiration cytology, which is FNAC, which is involved aspirating about zero point 0.3 milliliter of clear fluid, has been utilized to identify microfilaria in subcutaneous swelling, means the uh, under skin layer under the upper arm. So as you can see here, the picture is the A is basically on the circle. You can see the swelling, the redness swelling of at her upper arm. So it basically before the treatment, and the B here is after the she get the treatment properly. So you can see here there was no the swelling or any redness, bump or anything. So she was completely healed. So here is the microscopic finding. So the smear was shown presence of thin, slender, colorless thread like a larva with blunt head and tail tip free of nuclei that were also identified, which raised the high suspicion of the Wucheria bancrofti. So the other supportive tests that was also include such as a blood smear and ultrasound to detecting the live worm. So after there was identification of the Wucheria bancrofti, night blood sample failed to show the growth of the microfilaria. So as you can see here, the picture is you can see the filariasis here. After using by the Gymstar stain with 100 times oil magnification, so it was identified as a Wucheria bancrofti filariasis. It's a you can say yeah. So, the treatment and also the final outcome of the patient was she was started on oral diethylcarbamazine 100 milligram thrice a day, which is a 3 a day for 21 day continuous, because this oral give excellent result which with regression of the infection. So the final outcome, there was a tremendous decrease in the swelling at the end of the 4 weeks. Also, there was disappearance of axillary lymphadenopathy at the end of 3 months. So the patient was closely followed up for 2 years and showed no sign of recurrent infection. So she was completely healed and no recurrent infection like she will like have the bump or any swelling anywhere. So she was healed fully. Okay, we also have the preventive measure because the prevention is always better than cure. Okay, here is the example of the prevent the filariasis. Okay, number one is the mass drug administration in endemic area. So, by giving the preventive medication to entire community that in high risk area. And number two is the mosquito control. By using the bed nets, insecticide in this like red sac, and also eliminating the stagnant water, it can also reduce the mosquito breeding from grow from their life cycle basically. So number three is the personal hygiene and proper limb care. As you guys know, the to keep hygiene is basically our daily basic daily life. So by keeping the skin clean, also can prevent the secondary infection. And number four is the community awareness program. So basically by educating people about the transmission and also preventive measure that to reduce the spread of the disease from being the like infect effect to a lot of people that doesn't know about this kind of disease and how can it happen. So by giving this awareness to people, it can also alert and also educate people will know that this infection is uh, very high deadly lah, can cause also can cause fatal if you not get the proper treatment. So, last but not least, the conclusion is basically this case highlight an atypical presentation of lymphatic filariasis as the disease is usually associated with a lower limb lymphaedema rather than isolated upper arm swelling. So, the absence of systemic symptom also can maybe delay the diagnosis to emphasizing the importance of considering filariasis in patients with unexplained soft tissue swelling. So the FNAC fine needle aspiration cytology remain a valuable diagnostic tool for detecting microfilaria in subcutaneous lesion. So the early recognition and treatment are crucial to prevent complications such as a chronic lymphedema and secondary infection. This case also serves as a reminder for clinicians to include the filariasis in the differential diagnosis of persistent pendant swelling even in non-endemic area. So here is the reference that we have concluded about this research, and that's it from us, and thank you for your time to listen to our presentation. Thank you.